Hi, this is Dr. Farley. This morning's blog, what I want to go over with you is a research article that came out on February 19th, 2018. It was published in JAMA Neurology, and the title of it is, When Do Alpha-Synucleinopathies Start? An Epidemiological Timeline. So I thought this was an important article to review because this is talking about when do we see signs of neurodegeneration, and how long before we get the major diagnoses do we see these soft signs that the neurology is breaking down, and that if we understood that, we may be able to go back and take action way back when to not let the person get to the point now when we have a full-blown medical diagnosis. So the pathological hallmarks of the Alpha-Synucleinopathies. This is a group of different neurodegenerative diseases. So these are Parkinson's disease with dementia, dementia with Lewy bodies, multiple systems atrophy, and it basically says that they begin years before a clinical diagnosis. My looking at all the patients that I see coming in, most of these symptoms have been around anywhere from 20 to 40 years, or someone's whole life. When we look back on these things here, and we say, geez, if someone only would have mentioned to you that this is what that means, it could be easily a sign of neurodegeneration. So there's a long gap between pathology and the symptoms, and there's also certain non-motor conditions that can show up. So a couple of things that are important to understand when we're looking at this here. One of the first things that we may see is abnormal smell sensation. So we can get dysfunction. It can be either hyper sensitivity or I can't smell something. And a lot of people, if you go back and you ask them these questions, they say, yeah, my sense of smell has always been off. I thought I just had whatever it may be. And they never recognize that could be a very early sign of neurodegeneration. Another one is dysautonomia, and constipation being one of the main symptoms of dysautonomia. 90% of the output of the brain goes to the autonomic nervous system. So when the autonomics are off and there's beginning of neurodegeneration, one of the first things we may see is constipation. We may also see erectile dysfunction, blood pressure irregularities. We may also see blood sugar irregularities. We could even get where we have temperature abnormalities. We also may get when we stand up, we feel dizzy. All of those things can be early signs of dysautonomia, and again, could be an early feature of future neurodegeneration. Anxiety disorders and depression. Yes, believe it or not, anxiety disorders and depression can sometimes start 20 to 40 years in people, and they're the first sign that the brain is breaking down. So I tell people all the time, let's not talk about the psychological plausibilities or possibilities as to why you have this thing called anxiety and depression. Let's look at these issues as the brain not working properly and restore normal function. We also see sleep disorders. If you're not sleeping, it's a sign the brain is breaking down. You don't just have insomnia. I'm seeing these commercials now for narcolepsy. That could easily be an early sign of neurodegeneration, and if you treat it as narcolepsy, which is a name for your symptoms, you're missing the true understanding of what's happening. And then anemia. I would tell you that almost 90 to 95% of all patients I see have some form of anemia. Anemia can be very subtle. If you don't get a very big blood test, you may not see it. And then there's also two different ranges to look at the numbers of your test results. There's the sick range, and outside those sick ranges, you might not see any abnormality. When we look at the healthy range, it's rare that we don't see someone having some low-grade anemia, 1, 2, even 3 types of anemia. So I hope you found this interesting. These are some of the early signs of neurodegeneration, and if we looked at these signs as a sign that the brain was breaking down, we may be able to take some action at that point in time and prevent major neurodegeneration from continuing to rapidly move in the wrong direction. Thank you.